Hey, we're here with Dr. Rick Podolin. I got it right the first time. We met 2 years ago.
2 years ago.
Okay. And you are a high-level tennis player.
Competitive tennis player.
And you came to me through a mutual friend who I think actually had known more about this machine that we're using right now, which is an EMTT machine, so extracorporeal magnetotransduction therapy machine, wondering how this could be used to help your situation. So you're not like you think you're a tennis player, you got tennis elbow, but that's not your situation. You've got a radial nerve issue, more specifically a posterior interosseous nerve issue. And can you tell us, like, what were your symptoms going back to your initial injury or your diagnosis? When were you originally diagnosed?
Wow, it goes back to 2005. So just on the tennis court, hitting a backhand, just pop. And
that's right.
And I think what was a little different than just traditional tennis elbow, because of the nerve involvement, was I was having a lot of symptoms in my hands.
The dorsum of your hand.
Yes. So
right.
It was tingling there and just a lot of pain, just in the where the radial tunnel.
So going back a long time, so it's 20 years.
Yeah.
Okay.
Yeah.
And then how were you originally diagnosed? What did they do to diagnose you?
Well, it took a while. I remember seeing the initial surgeon didn't believe in radial tunnel syndrome.
Okay.
Yeah, so there's a little controversy in finding a doctor who was willing to sort of work with me on the nerve component.
Mm-hmm.
And really it was just sort of letting it ride out and not playing tennis for sometimes months. And it would sort of quiet down, and I had to modify how I played tennis and move to a two-hand backhand.
So you had to modify your activities.
Yep.
Okay. Eventually you had some treatments before surgery, is that right?
Yes.
What kind of things had you done before surgery?
So a lot of just general rehab,
right?
Yeah, kind of just focusing on the radial tunnel, as well as at some point looking at the common extensor tendon.
Okay, which is the tendon that normally you are going to injure with tennis elbow or common extensor tendinosis. And then before, I know you had surgery at some point in time. You had that inertial procedure to release the compression of that posterior interosseous nerve, just kind of a little bit further downstream than your elbow, but where that arcade of Froze is located. So when did you have that?
So that was in 2019, but the event that really threw things up in the air and became very kind of chaotic was I was involved in a car accident.
Oh, that's right.
And I really didn't sort of, make a connection that how could pain in my neck suddenly cause the management program I was using for this just to go haywire.
Stop working.
Didn't play tennis for a year or two.
Wow.
And so I got close to retirement and said, I need to really attack this.
Okay.
And really go after it and go to a surgeon. And then, we essentially did surgery to decompress the nerve, to clean up the common extensor tendon.
Yeah.
But we didn't do anything up here on the neck.
Right.
It was really seeing Dr. Hashimi, who brought up the possibility of a double crush. Having that nerve impacted here.
Up here and down here. So
Yes.
double crush on the nerve at two separate places.
Yes.
Okay.
Yes.
Right.
And so once we started injecting and treating that definitely helped. I was able to get back on track. But it wasn't until I came here and started working with you, John, that kind of getting platelet lysate, it seemed like that really was, and knowing that there were two different places that were involved, getting platelet lysate, some of the other kind of innovative new treatments.
Right, so I saw you 2 years ago.
Yeah.
And then before that, you had some injections of dextrose. Had you had PRP too?
In the common extensor tendon.
Common extensor tendon. And so you saw some of my my kind of mentors, my colleagues up in Philadelphia area, and those things helped you.
They did, but not as long. We've gone 2 years.
Right, so I treated you with platelet lysate 2 years ago. So when platelet lysate is just taking the platelets from your blood, and then we break open the platelets to get at their growth factors and anti-inflammatory proteins. And so we injected you 2 years ago in August at the radial tunnel, at the nerve, but then also up in which is your brachial plexus, right in your supraclavicular region. So the brachial plexus, before it dives down into your arm, we treated that double crush by treating it lower and higher. And we did it. You did well, and I hadn't heard from you until June of this year. and you were like, "Hey, I'm kiteboarding, I'm doing this and all that," and you've been very active since I last saw you.
I think about a year ago, I sent you a little clip of kiteboarding,
That's right.
and I won a USDA tennis tournament.
Yeah.
But just to let you know, like I was just, doing great.
Right.
And I was a little shocked when this year, kind of playing against a player hit a pretty big ball.
Uh-huh.
I sort of felt some of this. I almost thought that the whole thing had went away.
Gone away. It's over. Yeah.
But I'm realistic.
Okay.
As a psychologist that treats pain,
Yeah.
that sometimes you have to go back. And so, I'm really happy to be here
Good.
and for us revisiting the treatments that we did before and even doing an add-on.
Yeah. So today you said, "Hey, I wonder if we take that lysate and inject into the tendon, which we didn't do last time. I wonder if that would have any additive benefit." And initially I thought, common extensor tendon, I got to draw up some leukocyte-rich PRP, which can be inflammatory. And I thought, well, that wouldn't be good for the nerve. And so you kind of said, well, couldn't we just inject the lysate at all 3 places? Which I was like, okay, thinking outside the box, I like it. So we injected lysate at all 3 places. And so I don't think there's any harm in doing that for your tendon.
Mm-hmm.
Will it be effective for the tendon? I think so, because the tendon on ultrasound didn't look that bad.
Okay.
It didn't look that bad. So I think it's kind of just extra coat of paint on everything. It
I
makes
think that's
sense.
more of a minor component,
Yeah.
but one that sort of reared its head a little
Right.
bit more this
Yeah,
last
because you
time.
felt it when you were hitting
Yes.
a big return. So what are the procedures like? What is the injection like for you?
To get platelet lysate?
Yeah.
To me, it's really easy.
Yeah.
I almost think drawing the blood is the worst part, to be
Okay,
honest with you.
okay.
I can tell that it's numb, the skin's numb,
Okay.
and it's kind of cool, actually. You can kind of see on the screen the tissue.
Yeah, you were
And-
looking at your ultrasound as
Yeah,
we were doing
yeah.
it. Okay.
Yeah, so I feel very kind of detached and just, no real discomfort.
Didn't need any
Yep.
drugs. Didn't
Yep.
even need an IV.
Yep.
Since we were using kind of your lysate and not an anesthetic. So great, and we're using that EMTT. Word has it you might have gotten a version of this machine for use at home.
Well, as a 66-year-old tennis player that wants to just keep going,
Yeah.
I'm willing to push the envelope.
Right.
And bring to bear any technology. I do actually a lot of at-home stretching,
Yep.
injury prevention.
Right.
So to me, it just sort of is an
Yeah.
add-on to what I'm doing.
Yeah.
It's a little more
No
traditional.
brainer.
Yeah.
All right. Well, cool. Well, I guess it's August 2025. I'll see you in 2028 maybe.
Okay, maybe we're gonna
Yeah,
stretch it
We'll
out.
stretch it out a bit with that
Yeah.
extension pen.
Yeah.
Great. Well, thanks for coming to see me again.
Okay,
Appreciate it.
it's been great. And John is so easy to work with. I have to tell you, there's a real attention to detail that I've felt, and just really easy to talk to and ask questions to. So it's been great.
I appreciate that.
Mhm.